Episode 38 B Wendy and PM 2.5 in Brazil wildfire, wood, smoke causes cancer deaths. Wendy noted that long-term exposure to fine particles 2.5 micrometer in diameter, PM 2.5, has been linked to cancer mortality. However, the effect of wildfire-related PM 2.5 exposure on cancer mortality risk is unknown. A statistical study evaluated the association between wildfire-related PM 2.5 and site-specific cancer mortality in Brazil, from 2010 to 2016. Nationwide cancer death records were collected during 2010 to 2016 from the Brazilian Mortality Information System. Death records were linked with municipal-level wildfire and non-wildfire-related PM 2.5 concentrations. In total, 1,332,526 adult cancer deaths, age greater than or equal to 20 years, from 5,565 Brazilian municipalities, covering 136 million adults, were included. The mean annual wildfire-related PM 2.5 concentration was 2.38 microgram per meter cubed, and the annual non-wildfire-related PM 2.5 concentration was 8.20 micrograms per meter cubed. For all cancers combined, the attributable deaths were 37 per 100,000 population and ranged from 18 per 100,000 in the northeast region of Brazil to 71 per 100,000 in the central west region. Wildfire-related PM 2.5 attributable cancer deaths ranged from 0 to 822 per 100,000 population for municipalities during the study period, assuming the association is causal. In total, there were 53,135 cancer deaths attributable to two-year average wildfire-related PM 2.5 exposure from 2010 to 2016. Though the highest cancer mortality rate was in the South region, the number of attributable cancer deaths per 100,000 population was higher in the Central West region, 75 per 100,000. Males and people 60 years or older experienced a higher cancer burden. Along with increased cancer cases and higher wildfire-related PM 2.5 exposure, the number of attributable cancer deaths was more pronounced in 2015 and 2016, which is consistent with the high wildfire-related PM 2.5 exposure in those years. Mary noted that the focus of residents against wood smoke emission particulates, ROSEP, is on the health effects to near neighbors of living next to residential wood burning, in those hyper-localized areas where the source of particulate pollution, PM 2.5, is concentrated. PM 2.5, particulate matter of 2.5 micrometer size, is the perfect size to infiltrate the human lung, causing a cascade of human health problems. Wood smoke consists of 90% PM 2.5. Residential PM 2.5 monitors can be purchased by neighbors from Purple Air for less than $300, and their locations are put on the online Purple Air map, along with data uploaded every 10 minutes, available to the general public, and of course, to governmental authorities. Neighbors of residential wood burners would like their Purple Air PM 2.5 monitor data to be used to regulate and shut down residential wood burning detected at neighbors' fence lines that exceeds the World Health Organization, WHO, standards of 5 micrograms per meter cubed or future U.S. standards of 8 micrograms per meter cubed. There could even be court-ordered monitoring using a neighbor-owned Purple Air PM 2.5 monitor as a breathalyzer, similar to car breathalyzers court-ordered for repeat drunk drivers, to turn off the ignition of a neighboring indoor wood stove when levels of PM 2.5 in a near neighbor's yard is exceeded. In this way, governmental authorities would not have to check the make and model of an appliance and would not have to rely on unreliable certification and other worthless assurances of levels of wood stove particulate emissions by the company that manufactured it. Purple Air monitors also provide data every 10 minutes 24 hours a day, and data can be downloaded from the map by governmental authorities the day after the PM 2.5 levels are exceeded, during normal government working hours. Purple Air PM 2.5 monitors are so reliable and accurate they are put on U.S. Air Now smoke and fire maps alongside $100,000 Environmental Protection Agency, EPA, monitors, correlated to the EPA monitors with a simple mathematical formula. But to publicize this, it is necessary to point out that living hyperlocalized next to a residential wood burner is essentially the same as living hyperlocalized next to any kind of PM 2.5 emitting wood burning appliance, next to a PM 2.5 emitting wood burning wildfire, or next to a PM 2.5 emitting industrial biomass wood burning facility.